Testing, testing. Okay. My name is Dr. Devin Luzod. I have been in practice 25 years, been speaking here at Sun City about that long. I see quite a few patients in the crowd, so it's good to be here with some friendly faces as well. With us today, we have Jenna and Cindy from our office who donate their lunchtime a few times a year to come here and bring you guys some snacks and help out. So we appreciate that, yeah, for sure. Today's class is going to be about resolving neuropathy, and that starts with diagnosis, finding the cause. Differential diagnosis, which means there may be some other causes not even related to neuropathy. Treatments, and in some cases, resolution. There's some causes that I don't work with. I refer those out. I'm no good at them. So today's class is not about you coming to see me. It's about me helping you find the right diagnosis, the right treatment, and the right doctor. There's one specific cause that I'm best known for, and we'll use some examples from our office. But really, today is about freedom. When I sit down with a patient, oftentimes they're not saying, hey doc, I want 57% less numbness, tingling, and burning in my feet. What they're telling me is I want to be able to trust my feet again. I want to be able to go to the grocery store and not have to hang on to something to get around. I want to get to the bathroom at night and not fall over, or just get better sleep because my feet or my back aren't bothering me. I just want to be able to get to my car, to Costco, to the church, even to go see a grandson's baseball game, vacation, and not have to worry about, the number of steps that I have to take. Because neuropathy in particular, and even some of the differential diagnoses, sciatica, spondylolisthesis, stenosis, we'll talk about those. It's not even about how it makes you feel, it's about what it stops you from doing. In other words, we give small concessions. Well, I don't take stairs so much anymore. Okay? I don't like to go shopping by myself anymore. It takes away confidence. It makes your world smaller. And what I'm about is helping you make your world bigger and getting your feet to take you all the places you want to go and getting your body to do the things you want it to do without as much help. Does that sound good? Okay, let's do it. Raise your hands if you've ever felt numbness, tingling, burning, or less steady than you used to be. Absolutely. Your feet are sending information to your brain every single second. The brain is communicating back to the feet. Today we're going to talk about what happens when that conversation between the brain and the feet get interrupted. Your feet are actually sensory organs. Every step sends information upstairs, pressure, position, surface underneath you. Your brain takes that information and makes tiny corrections, so without consciously thinking about it. So numbness, for example, it's not just what you can feel, it changes the quality of the information that your brain has available to control your movement. Neuropathy isn't just a diagnosis of why. Numbness, reduced sensation in the feet. Tingling, pins and needles, usually worse at night. Burning, heat sensation, feet feel cold, weakness, you end up tripping, foot fatigue and foot drop, and balance changes. Neuropathy literally tells us that there's a problem involving the peripheral nerves. It doesn't automatically tell us the cause. And that's really the conversation starter for this talk today is, if you have burning, numbness, tingling, weakness, pain, frankly anywhere in your body, but in your legs or your feet, do you know exactly why that's happening? Now, it does commonly begin in the feet because those nerves headed from your spine all the way down to the feet are the longest, so that's affected first. But later, it can even affect your hands, the classic stocking glove pattern. So I don't want us just to stop at the word neuropathy. I want to talk about what's actually affecting the nerve. The first question should always be why. Metabolic and systemic causes. Diabetes is a cause. B12 deficiency is a cause. Autoimmune conditions. Medications can even cause it. Chemotherapy. I don't work with those things. Those are some other doctors we're going to be talking about. My wheelhouse is mechanical, structural. Something called spinal stenosis. You know what spinal stenosis is? Have you heard of it? Think of this. Your spine, this guy over here, has 24 bones in it. Each bone has a little hole. So if you stack them all up, there's a long canal down the middle. It's like if you stacked up 24 tires. Well, if one of those tires is just a little bit moved out of place, that's now stenosing your canal. It's a narrowing. And that's a mechanical cause. You can have something called spondylolisthesis, which means that bone has moved backwards or forwards. Nerve compression. If a doctor tells you, well, I think it's a pinched nerve, that's many times due to mechanical. And then unfortunately, there's a category of patients that's idiopathic, unknown. There's no clear cause. Investigation still matters. And sometimes there's multiple contributors involved. In other words, you really went for it. You took something from this category and combined it together. And your feet may not be where the problem starts. Diabetic neuropathy, for example, causes metabolic nerve damage. Compressed pinched nerve actually happens up in the spine. What we talked about, lumbar spinal stenosis, and there can be nutritional and systemic problems. So think about this. You think about an electrical cord. The lamp flickers, the problem could be at the bulb, could be at the outlet, could be at the cord. Nerves work somewhat similarly. When you experience the symptom, it's not necessarily where the irritation originates. That's why good examination is important. Okay, here's a case study from our clinic. Burning, tingling, numbness in her feet. This is Judy. She's 74 years old, and she reported burning, tingling, numbness in both feet, pain level 6 out of 10, frequent symptoms into the lower legs and tailbones, and she just couldn't really sit comfortably in the evenings. What our evaluation found is postural and pelvic asymmetry. So we took this x-ray of her pelvis. This is her right hip here. This is her left hip. And there was about 1.5 inches difference in hip height, which makes one leg hit the ground differently. That's a cause of compression of nerves down into the feet. What else? She had spondylolisthesis. This is tough to see, but this is her x-ray we took from the side view. This bone slid backwards, and that compresses the nerves down. Stenosis and disc space narrowing, also known as degenerative disc disease. All possible causes.
Well, hi everybody. I would like to talk a little bit about my experience with getting my neuropathy treated here. So I tried lots of other things. Neuropathy, the feet can burn, they can tingle, they can really hurt. And I went to you if you are concerned about it, that this could be a good option for you. This is a gentle chiropractic clinic. They never do a rapid crack till you think they just tore off your hip. The staff is delightful. I feel like I'm walking to see my girlfriend 3 times a week. Hi, lady. They'll make you feel that way too. I fill up 4 miles a day at minimum. I do everything I want to do. I volunteer at the food pantry, lifting cases of food and helping my clients. And I think if you have neuropathy or think you do, this would be a really excellent thing for you to try.
So this is just where people can get into trouble with good old Dr. Google. The same symptom can come from very different problems. Later, we're going to look at a case where they thought they had neuropathy. It was sciatica. And again, you can have 2 problems at once. Someone with diabetes can also have spinal stenosis. Someone with nutritional issues can also have a pinched nerve. So the label matters less than figuring out which bucket or buckets you actually belong to. Okay, so the biggest fall risk isn't always just weak legs. There's 5 systems that feed signals to your brain. Vision reads the environment. Feet and skin, ground contact feedback. Your inner ear detects head movement. One of the things I've noticed in about 20% of our cases is when someone comes in with trouble balance and they think it's their feet, there's actually an interruption in the upper part of the neck called the brainstem area. These same people have things like dizziness, vertigo. Have you heard of tinnitus? Things like that. Those are all things we commonly see as well. Reaction speed and spine and joints senses your body position. Strong legs alone don't guarantee good balance. Here's the surprising part. You can have pretty strong legs and still have a lousy balance. Balance is primarily an information and reaction problem. Your brain has to know where you are, recognize that you're moving off center, and organize and make a quick correction. If one source of information gets weaker, the other systems have to work harder. Okay, can I teach you guys some balance improvement techniques? All right, now this is a participation class. You get special points for participation, and I think we have chocolate up there for you at the end. So if you'd like to learn a couple things to improve your balance, let's have everybody that can go ahead and stand up for me. We're going to do a balance test, and then I'm going to teach you how to improve your balance. You have the chair in front of you. People in the first row, you don't have a chair, so be aware of that. Okay, the first test and technique to improve your balance is, and just again, if you need to have your hands nearby, please do it. Start to bring your feet together and bring them all the way together. Hold that together position for 15 seconds. Now, if you wobble, you got to sit down. You're out. Okay? Wobble and catching yourself doesn't count. Okay, good job. Feet back to normal position. That's the first exercise and test for balance. Next one, we're going to go a staggered stance. So what you're going to do is move one foot in front of the other and the other foot back a little bit into a staggered position. Good. Now if you wobble, you got to sit down. 10 seconds. Okay, I saw a wobble. All right, back to shoulder width apart. Good job. That is actually an exercise you can be doing on your own. Obviously, you switch your feet up. Okay, here's the harder one. If you need something to hold on to or nearby, keep it nearby. You're going to shift your weight onto one foot and raise one leg. So you're going to be on one leg. Okay? And sit down if you wobbled. Okay, good job. Now this is the last one. Yep, we got that. That one usually gets some people. Okay, now the last one is you're going to go onto one leg and then turn your head side to side. Okay, have a seat, guys. Good job. You did great. So I've included, and some of you guys got the handout, which is at the end of the class, but I'll give you a handout at the end which summarizes some of this information. Those are things you can be doing on your own to strengthen your balance, and the key is to build your way up. But again, a surprising part is that treating balance is not just a leg thing. It is information from your brain on down to the rest of the body. So it's not something you either have or don't have. It's very trainable. But there is an important distinction between training and testing balance. So we want a challenge that's small enough that your nervous system has time to adapt, not one necessarily big enough that finding out whether you can catch yourself before you hit the floor. So start easy and work your way up. The final one is you raise one leg, and after you know that you can turn your head side to side, then you close your eyes. Oh. Okay, but science tells us that if you can do that with one leg raised, you don't even have to have your eyes closed. One leg raised for between 20 to 30 seconds, that is a big predictor in longevity. So work your way up to it. Okay, more support isn't automatically better. Good footwear balances 5 things simultaneously, but no single shoe does them all perfectly. A good shoe should bring safety, reduces fall risk and injury, stability, supports ankle and arch, sensory feedback, maintains ground contact, cushioning, protects sensitive feet, and proper fit, obviously. But more support isn't always better. A $200 shoe isn't always the right fit for everybody. The right amount of support depends on your feet, sensation, stability, and walking mechanics. A heel lift. Let's talk a little bit about that. Some people have been prescribed a heel lift because they have one leg shorter than the other. Like we saw in that x-ray earlier, one leg shorter than the other also tells us that one hip is higher than the other, which also points to an impingement in the back. If those hips can be leveled, that leg will naturally come down. So if you've been prescribed a heel lift, it may actually be holding you out of place. Many times we'll see new patients, and don't do this without a consultation, but many times we'll see new patients and ask them to remove that heel lift so that we can get their hips naturally balanced. Okay, what you stop practicing is often what you lose. Use it. Stairs when you can. Take some small stairs. I don't want to go up those stairs. Try a couple, then come back down. Build your way up. Turning your head while walking is a great practice. Uneven surfaces. Sitting to standing. Just sitting to standing alone is a great exercise for your low back and your legs. But you quietly lose stair confidence, ability to adapt to terrain. Walking the same flat route every day is not always necessary. You want to be challenged a bit. So this is one of the biggest misconceptions just about aging in general. You know, I walk every day, so I'm covered. Walking is fantastic, but try some different surfaces. Try uphill, downhill a little bit. Things that challenge you just enough to gain better mobility. Okay, here's another case study. Leg and foot numbness, but it wasn't neuropathy. This is Stephanie. She's age 52, 7 months of worsening symptoms. Low back, left buttock, posterior thigh, lower leg, and foot. Tingling, numbness, burning pain up to a 9 out of 10. Walking increasingly difficult, sitting, driving, bending, aggravated symptoms. She had her blood tested. The B12 deficiency was not there. She got checked out for diabetes. There was not a diabetic component. And so in our evaluation, here's what we found. In her back, she had, tough to see, this is a scoliosis. Scoliosis, a lot of times we're born with those. What happens is you have a curvature in your back, and it worsens until you're about 18 years old. But around 18, 19 years old, the bones harden. So until you're about 50, that scoliosis doesn't change. But guess what happens to the strength of our bones around age 50? Yeah, they start softening. So a childhood scoliosis ends up bending more and more and more. That's another reason we shrink as we get older, is we see these scoliosis working. So interestingly enough, past the age of 50, I'm actually much better at improving these because yes, the bones are softer, which can hurt you, but I can move them much easier into place. And then she also had what's called a spondylolisthesis, which again, tough to see, but that lowest bone had moved backwards. So it ended up causing her to have the symptoms.
Hi, so a few years ago, I started to develop some pain in my leg and my left buttock cheek, and I thought it was just a bad pain because I've been in, but it just got progressively worse over 2 months, and so I started seeing my doctor and getting some referrals, and I feel like I saw everybody. I got shots, and my pulmonologist, an orthopedic surgeon, physical therapy, and just nothing really. And I ended up unable to sit down for attention. If I was work, I was laying down. If I was at home, I was laying down. I was looking at my feet, leaning against my legs. It was just unbearable. But with just repeated adjustments and treatment, and really just staying on the path that you put me on, especially in the exercise and coming in regularly, just really prioritizing health. I feel so much.
Differential diagnosis, it's important. Okay, your body is better at compensating than you think. Pain, numbness, tingling, balance changes hidden below that are compensation patterns. altered walking mechanics, progressive avoidance, structural changes building over time. These are things that can be helped with posture training. Can I teach you guys a couple things with posture? Okay, because today's class, I want you to be able to take some things away from here. Whether you continue the path to get a diagnosis with a doctor or our office, these are tools and techniques we teach our own patients. Okay, we're going to go through some perfect posture situations. So everybody, I want you to put your feet flat on the floor for a moment. Okay, and then bend forward a little bit in your chair. Now, wiggle your rear end all the way back so it's deep into that chair, as deep as it can go so it can hit the back. Now I want everybody to sit up and lean back. Wow. This room just got about 15 years younger. You look great. That's good posture, but what do we end up doing? We end up kind of sitting on the middle of our chair or even on the edge of our chair, and then what do our backs do? Yeah, but studies have shown if you get your rear end all the way back so it hits the back part of that chair and lean back, you're more likely to sit up straight. And that also affects this guy up here, which is called the dowager hump. That's a different seminar. But a lot of times this and the head leans forward, that ends up affecting the low back and causes falls as well. Okay, so your feet need more than just comfortable shoes. Some things you should be doing: inspect your feet daily, especially with diabetes or reduced sensation. Wear properly fitting shoes. We talked a little bit about heel raises. I'm not against them, but sometimes it's actually holding the problem back from getting corrected. Address your wounds properly. Any redness, swelling, any break in the skin, again, that's not what I do. That's going to be your doctor. Ankle pumps and circles. This is great for circulation. We teach a balance course, and this is one of the most important things you want to do anytime you get up from a sitting position. Could be at a restaurant, could be at your house. So what I want you to do is extend your legs in front of you, put your heels on the floor, so toes up, heels on the floor, and then just start pumping your feet like that, okay? So just like this, and you just want to do that about 10 to 15 times, and that's going to drive circulation all the way up through the legs, up to your heart and back down, which makes it less likely when you stand up that you get that blood rush wobble. So pumping your feet is important. And some stretches you can do is also calf stretches against a wall. But what you can't feel can still injure you. One practical rule: if your sensation in your feet is reduced, your eyes need to do some of the job your nerves used to do. And that's why looking at your feet becomes important. So you may not necessarily feel a blister or a pressure spot, but don't underestimate the condition of your feet, and don't underestimate ankle motion. That pumping of the ankles is tremendously important for ensuring balance. Okay, in the neuropathy conversation, diabetes kind of deserves its own rule book. Medical management comes first. Again, this is what I refer out. I'm no good at this stuff. Blood glucose control is obviously the conversation. Type 2 diabetes is known as a condition that you can eat your way into, but you can also eat your way out of it. And a lot of times that has to do with better dietary choices. Nutrition and weight management. Foot protection is non-negotiable. Again, inspect daily and your function can still improve. I want to give you a couple things that you can do nutritionally. We're not going to get a bunch into this, but there really isn't a magic neuropathy diet. What matters is whether something is metabolically affecting the nerve in the first place. So for someone with diabetes, obviously glucose management. B12 is another good example. Too little B12 can cause neurological symptoms. So sometimes the appropriate answer isn't even a treatment. It's just identifying a deficiency. So my general advice is kind of boring, but effective. Adequate protein, plenty of minimally processed food. What's a processed food? Usually white bread, things that tell you they're healthy, but they sneak sugar in. Vegetables, fruit, healthy fats. What's a healthy fat? What's an example? For sure, olive oil, avocados, nuts are great. Appropriate hydration. Gotta tell you, the body, by the time your body tells you you need water, it's too late. So you have to be drinking regularly throughout the day. Coffee counts, tea counts. And before spending any money on a cabinet full of, nerve supplements, just find out whether you're actually deficient in anything. And more isn't always better. B6 is a great example. We need it, but chronically excessive supplemental B6 can actually cause peripheral neuropathy. And that's about as counterintuitive as it gets. A vitamin marketed in some nerve products can actually become a nerve problem with excessive doses. Okay, so the danger isn't necessarily numbness. It's assuming you already know why you're numb. I've been told I have neuropathy, so there's nothing else to investigate. The warning light analogy. Okay, if 5 different engine problems can trigger the same warning light in your car, replacing the light doesn't diagnose the engine. A symptom you have tells you something's wrong, but it doesn't necessarily tell you what. So the mistake isn't having a diagnosis. The mistake is allowing a diagnosis to end the investigation. Well, my doctor told me I have to learn to live with it. When a doctor tells you that, what are they really saying? Yeah, that doctor doesn't know the answer. But there's multiple doctors and multiple ways to diagnose a nerve problem, whether it's going into your hands, your feet, or even up into your head. So continue checking it out is my message there. Old labels sometimes deserve new questions. But if your feet could talk, what would they ask you to pay attention to? Has my balance quietly changed? Reaching for walls more than before? Am I avoiding things I used to do? Fewer outings, shorter walks? Is numbness spreading or is it even worsening? Progressive symptoms could need reevaluation. And do I actually know why? Again, a label is not an explanation. This is where I want you to think less about pain and more about your life getting smaller. Maybe you stopped taking the stairs or choosing that restaurant that's too far of a walk. Those little accommodations can be the earliest sign that something is wrong and worth investigating. Okay, let's kind of recap what we've talked about. Evaluate, treat, follow up, components of finding care. Now, frankly, this is true no matter what your condition is, whether you have migraines or dizziness or balance or numbness and burning in your feet. The first step is always getting a good diagnosis. And that starts with a detailed health history and physical exam. A medical doctor can do this. A metabolic doctor can do this as well. And finding out neurological balance strength and posture testing. So my area of expertise is more the mechanical faults that could be causing neuropathy. So we're going to test posture. In our office, we're going to take an x-ray, but some of you may have gotten MRIs. What's an MRI going to show us that an x-ray doesn't? Soft tissue. Okay, so x-ray is going to show bones out of place, and an MRI is actually going to show the result of that. Is there a bulging disc in the low back? Is there stenosis? Is there nerve impingement that could be causing things as well? Okay, differential diagnosis, which is what we talked about. Do I truly have neuropathy, or do I have something closer to sciatica? Do I have stenosis? Do I have spondylolisthesis where the bone moved out? So getting all your diagnosis is important. And then blood work as well, B12 deficiency, metabolic syndrome. So these are all different types of doctors. Okay, the second part. So diagnosis first. The second part is matching the treatment to the findings. By show of hands, how many of you prefer to try to stay natural and non-invasive? Of course. And that's only because just about every drug, and I'm not against drugs or surgery, I've had to have both, and thank goodness for our doctors and our hospitals. But when you can be natural, we want to try to do that because we're avoiding some of the side effects. So natural treatment is best, but for example, gabapentin, very commonly prescribed for nerve problems, but there's side effects to that. And many of our patients have had to do both until they can get off of it. Okay, so match the treatment. In our office, we use what's called upper cervical care, which is a treatment to the top of the neck to rebalance the head and neck. We use something called an arthrostim. I'll show that to you. It's a gentle way of adjusting to open up the space and adjust the feet. So foot and ankle treatment, soft tissue work. Laser therapy is an emerging field that has gotten FDA approval. There's 2 types of lasers really two types of lasers available. One for therapy, one is a heat laser, a hot laser, and then the other is what's called FDA clear low-level laser therapy or cold laser. We don't so much see the hot in treating neuropathy or nerve problems. That's more of the cold laser. And then in the end, activity and movement modification is your doctor teaching you stretches, exercise, posture, things to do on your own. And then finally, down the road, re-examination and continuing to improve those things. Okay, strong steps today, more freedom tomorrow. Your feet are talking to your brain. Keep that conversation going. You do not need perfect feet. You need a nervous system capable enough to keep you walking with grandchildren, traveling, and everything you want to be doing. Successful aging doesn't mean trying to have the body you had at 25. It means having enough capacity that at 75, 85, 95, you can still say yes to the things you want to be doing. Okay, a couple very, very important ideas to take home. First and foremost, symptoms are clues, not necessary conclusions. I am always boldly challenging our current healthcare system because really what it is sick care. It's very, very good at helping us once we already have a problem. And frankly, it's fantastic at it. If I have a heart attack, where am I going? I'm going right to the hospital, and thank goodness we have that medical care. But with chronic problems, we sometimes fall into a different pattern. We wait for symptoms, we name the symptom, we manage the symptom. Again, gabapentin can help with burning and nerve pain, but it doesn't tell us why the nerve was malfunctioning. And of course, it can cause sleeplessness. Gabapentin can even cause dizziness and unsteadiness. So I'm certainly not anti-medication. I'm anti-stopping the investigation too early just because a pill makes us feel better. So whenever possible, I kind of want to know why the smoke alarm went off, right? I don't want to just get up and unplug the battery and think everything's okay. All right, so being proactive versus reactive. Early detection, early treatment is always better. By show of hands, how many of you would rather solve a problem early than wait till you get into the ER? Okay, what's that little mirrored cabinet called in our bathroom? Medicine cabinet. If it's full, are we sicker or are we healthier? So do we want it full or do we want it more empty? Yeah, and I agree. I feel the exact same way. You think like I do. We're on the same page. So just remember, it's not always just one thing necessarily holding you back. It's usually a multitude of things, and can be multiple diagnoses. Okay, so I got through the information pretty quickly. We went through. I want to teach you a couple other things posture-wise that can help you. We went through better sitting posture, and you don't have to keep that posture all day long. Your best posture is actually what we call your next posture. So getting into a good posture, and then you forget about it, but then you get back into a good posture. The same posture I taught you can use in your car. When you get in your car to drive, lean forward, sit up, adjust the mirror. Because if that rear view mirror, if you can't quite see out of it, what do you need to do? Okay. Sleeping positions. What's the best sleeping position? Side, stomach, or back? Okay, I hear some people say side, definitely not stomach, because what happens is this is not a former patient. Okay, so your brain sits up top here, and it sends the signals down the spine. There's a great big hole in the bottom of the skull called the foramen magnum, which is where your nerves go through. The foramen magnum is Latin, by the way. Do you know what it's Latin for? Great big hole. Okay. So the nerves go down. If you are a stomach sleeper, your head is cranked to the side. That can pinch the nerves in the neck. So the second best safe position to sleep is on your side, with pillows in between your knees, because that keeps your proper posture. The safest sleeping position, and many of us have to train ourselves to sleep this way, is on your back, maybe at a little upward incline if you have breathing trouble, with pillows underneath your legs because that takes pressure off of your lower spine. And then you get up in the morning, and what's the first thing you should do? Thank goodness that you woke up in the first place, and yes, do a big old stretch. Every animal on the planet does it. Okay, so posture, shoes, there's no best shoe. Brooks, New Balance make a lot of good ones. Hoka can provide excellent cushioning. Here's my test. The shoe should fit your foot today. Your heel shouldn't be sliding around. Your toes shouldn't be compressed, and you feel stable when you turn. And that's working from the base up. Okay, so we're going to take a few questions. If you have anything that we discussed by professional training in our office, I use mechanical means, gentle, low-force physiotherapy, chiropractic, to get pressure off the nerves down your back. This is one of the tools that we use in our office. It's called an arthrostim. Now, the kids call it the woodpecker. So we can go into a part of the spine and reduce a compression, a stenosed area, spondylolisthesis, degeneration, and open that up. Of course, people have this hump in the upper back. We use it there too. But really what I'm best at is correcting mechanical causes. We're great at biohacking the body mechanically. I'll show you a biohack. Okay, tuck your elbow into the side and show me your 6-shooter. Okay, go ahead and do this with me. Now, what I want you to do is, as far as you can without hurting yourself, keep that elbow tucked in, rotate your arm out as far as you can, okay? Look down at about how far you can get it out there. Usually it's about a 45-degree angle, okay? Now bring your arm back into your side. Now I want you to raise that arm up, reach it back, and tuck that elbow back in again. Now how far back is your arm? Okay, goes a lot further back. That's a biohack. We have 1 million of those to correct your spine. So if you think you have any type of misalignment or mechanical problem in your body, that's what we're best at. And you can check yourself. You can look in a mirror. Do I have one shoulder higher or lower? Do my hips feel off? Do I have one leg shorter? Is my head tilted to one side? Those are all mechanical causes of nerve impingement. And if you wanted to have us evaluate that, the QR code can get you there. The gals can help you as well. Also, this QR code gets you to download. You can download a free copy of my book, Live to 100 and Want to. Okay, yeah, let's take some questions. Go ahead. Okay, so what he asked is, does that thing work for sciatic nerve? I take it, is this for you or you're someone you know? Okay, can I ask you a couple clinical questions? Which leg is it going down? Okay, and so it's not going down to your toes? That's okay, so yeah, definitely not a neuropathic condition, but a pinched nerve in the lower back. Sciatica is one of the most common things we treat. So in fact, our second case study that I put up there, she was purely sciatica. And so when I evaluate that, I'm going to do a health history and exam, but we're going to take x-rays of your lower spine to see if there's compression. And if there is, I have pretty close to an 80% success rate with sciatica.
Follow up to that. What if there's a couple forward thrust vertebrae also?
Okay, so she asked a question about what if there's a couple forward thrust vertebrae. Now that's a condition called spondylolisthesis. We mentioned that where, remember that stack of tires? Somebody comes and kicks a tire forward or backwards. And what we do with that in our office is we actually move the bones above and below with the arthrostim, the ones that are back more forward to get in alignment with them. And you don't need much. You only need to move it 1 or 2 millimeters to get pressure off a nerve. So if we can shift a bone that much, that's a lot of times the difference between nerve pain and not. Great question. Yeah, you had a question, sir.
What's your feeling about acupuncture?
He asked what my feeling about acupuncture is. So that's out of my scope, but I'm all for trying things that are non-invasive, don't have side effects or complications. And again, we all need surgery and medication sometimes, but if you can start natural, that's what I'm for. Are you asking, can stenosis cause neuropathic pain?
Yeah, in the
Yes, and do you have neuropathic pain in your arms or hands? Okay, so great question. She asked, can a stenosis, or we'll just say a mechanical cause or problem in your neck, cause problems in the feet? It is a very common cause. In fact, this upper part of your neck, what's called the brainstem, controls temperature and pain and sensations all the way down the legs. So one of my areas of emphasis is the upper cervical spine, called your atlas. We do a very gentle series of treatments to that area, specifically to rebalance the neck. And it has a tremendous effect on down through the legs and feet. In fact, if you're only treating the low back, you're probably missing one of the biggest causes, which is the neck. Does that make sense? So yeah, your neck can cause leg and foot problems. Yeah. Yeah, so he asked about, is that necessarily a compressed disc in the neck? And there's almost always a disc component involved with mechanical misalignment. The thing of it is after 40 and 50, our discs really dry out, but the material is still important. So what happens over time, you know the term arthritis, degenerative disc disease, all that is imagine my fists are two bones in your back, okay? If the bones are moving smoothly, the disc will last you 100 years. But what happens to all of us is somewhere in our spines, those bones go just enough out of place that now they're grinding. They're not moving right. And so they silently deteriorate for decades. We take an x-ray and we can see the result. And someone says, well, gosh, I've got arthritis. My doctor said it's old age. And I ask them, well, how old is the rest of your spine when some parts look good? So we use that little arthrostim to open up that disc and get the pressure off. Does that make sense? Yeah. Yeah. Way at the end.
You meant about 2 years ago, my left arm and my neck went numb. I thought I was having a heart attack. I went to someone in the hospital and ran all kinds of tests. Found out it wasn't a heart attack. It was neurologically involved, and I also had arthritis. I was told I would have to have a metal post put in my neck.
These guys are having trouble hearing you. Let me recap. He was told he had to have a metal post put in his neck. Go ahead and stand up. He was told he had to have a metal post put in his neck.
And they said, well, your choice is either have a metal post put in your neck or go to PT. And of course I chose PT. It helped a lot. But then afterwards I decided the best way to keep from having a post put in is to go see Dr. Devin. And thus far to this day I haven't had to have an operation in the illness. And I'm just my claim for Dr. Devin's help.
Thanks, partner. You had a question?
Yeah, you mentioned neuro supplement, but you give only B12 as an example. What other neuro supplement do we have?
He asked about what other neural supplements we have. I'm not a nutritionist, so that's a little outside of my scope. The point of that particular section is sometimes those neuropathic supplements taken in excess can actually cause some of the same problems you're avoiding. So the point of that slide is the more isn't necessarily better. Yeah, go ahead.
One other question. The second woman on the video mentioned as a treatment laser
Yeah.
treatment and she got better.
Yeah.
What kind of laser treatment and where was it?
Well,
What parts of the body?
yeah, so that was a patient in our office, and we used, in that case, we used FDA-cleared low-level laser therapy, and we treated her lower spine because that's where the pinched nerve is. A low-level laser therapy was FDA-cleared actually originally from a condition called carpal tunnel syndrome, which is a pinched nerve in the neck or the hands, and it was found that this therapy improves that by up to 66%. So now we obviously used it for carpal tunnel, but now we use it on a lot of conditions because it adds circulation and oxygen and blood flow. So it's an important part of a mechanical issue, the alignment, but also lasering it to help the tissues heal. Okay, very powerful, yeah. Yeah.
When doing the balance exercises, how many do you do?
Oh, great question. She asked about when doing the balance exercises, how many times should you repeat it? So if it's, for example, feet together, you're just going to do it once. If it's split stance, you're going to do it on each side. And then basically, if it's one side or the other, you're going to do each side between 15 to 20 seconds. Now, you could do it morning and evening. So a couple times a day would be really helpful. Okay, just make sure you got a countertop nearby. Okay, good. Oh, you had a question?
What if all the tests show it's basically arthritis?
Then we consider that a mechanical cause. That's up my alley. Because remember, all arthritis is two bones or joints rubbing because they're out of alignment. So mechanically, if I can biohack that, if I can align it and get it moving smoothly, the pressure comes off, not only in the local area like low back pain, but it comes off the nerve running down the leg. So in the first case study, she had arthritis, Judy had arthritis in her back, but she also had it in her feet. So we treated both areas. So if it's the diagnosis is arthritis, then what you would do is we can schedule through the QR code or the gals can help you, okay? With us. That's what we evaluate is the mechanical issue. Okay, so the code or the gals can help you if you want for us to evaluate it as a mechanical issue. Okay, good. Very good. Well, listen, you guys have been great to speak with. I love coming out here. At any age, you can be anything you want, so be kind. Have a wonderful rest of your day.